Being a fourth-generation Crossfield resident, I thought I knew people. So I was shocked when another family came up to me after my son's funeral and shared that their son had also been dealing with mental health challenges. They didn't know how it started. He was not a bad kid, always polite, never partied, had a solid family. All of the things I had been saying to myself for the past 10 years. Over the next few weeks, many other community members shared that they were dealing with the same challenges in their families. And as I sat crying in my bed one morning, I thought to myself, why are we all hiding? In that moment, I decided I wanted to do something about it. 5 years later, I was having coffee with Therese, a facilitator with the Alberta Healthy Communities Initiative. We both presented similar projects to the town council and were connected through a mutual acquaintance. We quickly realized that we both had the same goals, developing a community-led, healthy living collaborative. I was focused on mental health and she was focused on physical health, but the outcomes we hoped for were the same. Therese had a process and I had connections. It just made sense to work together. As faces started popping up on the screen at our first information session, I was excited. Community members, business owners, agency representatives, town staff. Most of them signed up that day to help us create the Crossfield Wellness Network. At first, it was hard to meet over Zoom, getting to know people, learning to work together, staying focused. And there was a lot of groundwork and planning that had to be done. The community assessments were extensive and valuable for us to learn about the strengths and gaps in our community. But after the first 12 months of planning over Zoom, some conversations made me realize that people were getting restless. Like every committee, we had both planners and doers. Therese and I realized that we needed something for the doers if we wanted to keep everyone engaged. We needed some small wins. We scanned through all the meeting minutes and identified ideas that people suggested. And when we brought them up at the next meeting, the change in the group was noticeable. People started talking more, asking questions, volunteering to take on small projects. There was more energy, more direction, and after a year of discouraging pandemic restrictions, it felt like we could accomplish something that would matter right now, not in the future. We could create a healthy, resilient community in the midst of a very difficult moment for all of us. Over the past year, we started using social media to share wellness messages and promote activities that support our mission. We applied for additional funding and were able to print banners with hopeful messages and local resource cards. 7 committee members have done trainings to learn about trauma-informed care and create peer support programs for friends and family of people who have experienced trauma. And now we are working on a video series to promote local wellness services. All of these initiatives are in addition to working through community capacity assessments and planning for the future. We have still never met in person, but together we have accomplished a lot. And looking back on the last 2 years, I am touched by how many of us have stuck with it. I have always told myself that if I could help one person, then I have won. But I am thankful that as a group, we have already had a big impact in our community.